Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We've got a great podcast today. I've got Emily Tyson of Radix Health and myself are going to be doing a joint podcast today. We're going to be talking about patient demands for convenience, scheduling, and telehealth, brought to you by One Touch Telehealth and Radix Health. Emily she's the Senior Vice President of Strategy and Operations at Radix Health. She leads the company's efforts to scale rapidly by creating a culture committed to improving patient access. Prior to Radix, Emily served as VP of Product at naviHealth, where she was responsible for the vision and direction and product offerings for the health system there. As well, prior, she was at Curaspan Health Group and athenahealth. Emily, welcome to the show.
Thank you, Carrie. Excited to be here today.
Well, awesome. We're going to be talking about a bunch of topics today, and I want to set the stage a little bit. The patient demands have definitely changed. Patients are looking at other industries because as patients, we're consumers, so we don't really think about healthcare in this little silo. And it's really about convenience. Patients are demanding online scheduling, reduced wait times, and the ability to see physicians with telehealth or from home, work, wherever it may be. And then we have younger generations like Millennials that don't really see the need for primary care, or a lot of that has to do with convenience factors. So the primary care physicians are significantly lower with that demographic. Then we see telehealth has grown 1,400% in the last 24 months. It's absolutely insane right now. And the combination of online scheduling, wait lists, telehealth is just really kind of that nice marriage for practice groups, hospitals, health systems to really blend that physical and virtual world. So we're going to be talking a lot about that today, but I want to talk a little bit first, put on our patient hats, and talk about the patient experience first. As I mentioned, patients now can do online scheduling and so many other industries. They can click a button, hit ordering, and drive over to a retail clinic and get seen right away. They can get their prescriptions delivered, all of that kind of stuff. A lot of people like to say, well, healthcare is late to adopt technology. I hate when people say that. I cringe because I don't think that's a good excuse. But I want to talk a little bit about online scheduling. Where are we at as an industry right now of practice groups that actually have online scheduling? Is it, because I know on the telehealth side, it's only 15%. It's on everybody's roadmap because of some billable codes. And I know it's a little bit different. What are you seeing in the industry right now with practice groups that have online scheduling?
We've seen significant increase in this over the past year or two. And if we look at where we'll end this year and going into next year, we'd expect all of the top 100 health systems in the country, along with many of the independent practice groups, having some form of online scheduling going into next year. What's really interesting to me is the sort of so what of that, and what does that actually mean for patients and providers, and is introducing online scheduling in its current form, does that apply to all appointments, primary appointments, specialty appointments, and are we actually driving value there? And I think when you get into that and the real results and what it means for patient access and that experience, that answer is a lot less clear, and there's much more work to go do there to grow that.
Yeah, and so that's good to know. And as we look at the industry, I think, people have their EHRs. Some folks have practice management software. Some folks have, independent scheduling software, kind of all, tethered there. And, like telehealth and EHRs, there's obviously, some telehealth companies that have aligned EHRs and may not be the best one for that particular practice. But what's the difference of, if you look at online scheduling kind of as a whole, it's not just online scheduling. There's a bunch of bells and whistles and things that go kind of, behind the scenes from that. What should practice groups and even, like you said, health systems be thinking about when it comes to blending that physical and that virtual world from scheduling standpoint?
Yeah, that's a really great question. I think that's in some degree the question is the answer, is the idea of blending it. Often we see groups and health systems think about online scheduling as a standalone marketing tool that's completely separate from the operations of the practice and even how a call center that may handle scheduling appointments. And from the patient side, that experience needs to be the same. And so think about things, do you actually have real-time inventory available in your online scheduling? Are you able to tie, marketing events and other driven patient outreach into availability and ensure you can meet patient demand as it's coming in the door? How you're matching that supply and demand is really important. And can it handle the complexity of your group, of your practice, of your system? If you're working across multiple locations with dozens, hundreds, even thousands of providers, the ability to handle complexity goes far beyond just a calendar view of appointments and how you're balancing across the network and getting patients to the right provider. So depending on the size of the organization, obviously there's much more complexity behind the scenes, but the idea of matching, it's actually not online scheduling to be effective is not a patient-facing marketing tool. It truly needs to be an operations tool that can be leveraged.
Yeah, that makes so much sense. And as you look at, the complexity of kind of what you're talking about and so forth, I know you guys have done an amazing job on reducing, no-show rates, which is, depending upon what kind of subvertical in healthcare can be, really extremely high and cost practice significant amounts of money. With the online scheduling and kind of tying physical and virtual worlds, where are you seeing those, like the industry rates of no-shows and then kind of reduction from that standpoint?
Sure. You won't be surprised to hear me say it depends, right? Yeah. There's obviously by market, by practice, and everything else. I mean, if you're thinking about an organization such as an FQHC, the no-show rates are very high, easily above 20%. I've certainly seen them hit 50% at times, and that's pretty consistent across the country for those sorts of organizations. There are certainly ways that we can use the technology to reduce that number. There are reminders, messages, easy rescheduling options that add value, but I actually think what's really interesting is going beyond that and thinking about it on top of not just how do you reduce no-shows, but actually how do you reduce the impact to your practice. So a couple of things that I think are really interesting beyond that is, getting smarter about predicting who's actually not going to show up. So we think about predicting that rate, and then practices can actually assess capacity with the no-show in mind. And so you can intelligently decide to overbook for certain appointment slots or for certain patient slots, and you can find your own threshold for what makes sense there. But actually planning for it and changing how we think about capacity when you incorporate the concept of no-show is equally as or more important than actually reducing those no-show rates. And the second piece that is actually harder is less about the technology, but about the mentality and approach behind it. So we often work with clients to try to see the world a little bit differently. So for example, it feels great to have a fully booked calendar for 3 months or 6 months out, but that at the same time, it should not be a surprise that you're going to see significantly higher no-show rates when a patient is waiting 3 months for an appointment. Yeah. A lot happens in that time, and usually the moment's passed, they've gone somewhere else. And so in our conversations with clients, we often have discussions around how to change the way you're managing that appointment and availability in order to ensure you can see patients in a shorter time frame and that you're engaging them the right way along that appointment journey so that they show up. But that goes, technology is one piece of it, but the mentality and approach and kind of the operational aspect is much bigger, and that's a key piece of it has to change to ultimately drive down those rates.
Yeah, and I think you bring up a couple of good points I want to circle back with. We work a lot in the behavioral health side too, and those, we have clients that, no-show rates are 50, 60%, right? Because you're talking about reoccurring appointments that are every single week. It's very hard in this day and age to predict what you're doing next Thursday at 1:00, right? Things come up, you have families, you have work, you have things like that, right? And then You mentioned FQHCs, which on what we're seeing on our side on the clients there's a lot of transportation issues, right? And so there's transportation issues as we have these aging boomers at home. You have caregivers involved. There's just all this complexity that we historically haven't seen. And then when we look at different buckets where telehealth and scheduling kind of come into play even more is women's health. I mean, women are the last to make their own appointments. They're worried about their husband's appointments, their kids' appointments, all this kind of stuff. Children, there's so many last minute things that come up with kids being sick. You can't afford to wait 2 days to get in. If your kid's sick, you're going to take them down the street, clinic or EHR. And then, rural access has been just a major issue, right? There's so many shortages, and in some, areas it's 6-8 weeks for an appointment in these rural areas. And then there's a lot of, follow-up appointments where people just, that's usually the last thing to get canceled just because they feel like maybe they're better and they don't need to go in, or surgery, they already off all this work from that standpoint. So nailing down like some of those like industries that we just talked about and maybe some of those drivers, how do you see recently, One Touch Telehealth and Radix, we announced our partnership. So let's talk a little bit about, those drivers and now how that scheduling with the telehealth really works, and some of those scenarios. Where do you see some of those kind of scenarios that we just talked about on the demands, for getting faster appointment times, being on that wait list, and some of those demographics? How should practices be thinking about that?
Right. And obviously this is an area I'm excited about, and some of the conversations we've had in the past, because what we're seeing today, I mean, you've talked about the massive, the 400% increase in telehealth and the massive demand there, which is really exciting. And a lot of times makes sense in theory. And what we're seeing in the industry is a lot of practices, almost all of our clients are adopting a solution, or they've adopted a solution, and they think of it as an entirely separate vertical from how they manage the physical practice.
Yeah.
So what's really interesting about putting something like, intelligent scheduling right in the middle, and this idea of connecting the journey, is actually being able to help practices have a combined view of the world, what I think of as the inventory for the practice, to be able to say, what is all of our supply, what are all of the providers and appointment types and availability with all of the demand for all the different types of appointment, and then use the capabilities of the technology to actually drive patients to the right sort of appointment, and not, oh, well, is this patient going to end up in telehealth and either it's not clinically appropriate or maybe it's not financially appropriate, or is this a patient that I'm saying needs to come in but they don't have transportation, so they're not going to come in, and maybe telehealth is more appropriate. And so we can actually use the technology with input on the operations side to drive the demand to the right place and give practices a much broader view, and quite frankly just more capacity to meet those needs. At the same time, making life, easier for the patients and really meeting them where they are. So I think pulling these together and creating a holistic view is really exciting and has the potential to add a lot of value for those practices.
Yeah, and I think that's a great breakdown. And I think too, as there's been a ton of data, come out that, in most specialty, it's a 6 to 8 week, wait time. And that the average time that a patient spends waiting for an appointment is like 2 hours and 10 minutes. And the face time with the providers, 5 to 7 minutes, right? So let's break that down. Obviously, telehealth, provides a lot of that convenience and increases patient satisfaction, as well as online scheduling increases patient satisfaction from that standpoint. But I want to talk about, a lot of folks have been talking lately about kind of wait listing, right? And, if you need to get into the doctor today or tomorrow, but there's no appointments, well, let me know. Historically, if I was to get a call right now and say, hey, there's an appointment available at noon, there's no way I can just, jump up, cancel meetings, go and do that. But if I get a call that says, hey, we have a telehealth appointment available at noon, cool, I can shut my door, I can take that appointment, and the practice is not missing me, in the sense of there's, either I'm going to do that telehealth appointment with them, or I'm going to do a consumer facing telehealth application. I'm going to run into a Walgreens or a CVS, whatever. So how, when we talk about that from, kind of the provider standpoint, instead of missing those appointments, how does that wait listing, kind of work combination with the two? Because I think that right there is kind of really a key for a lot of issues practices face.
Mm-hmm. Yeah, I was laughing a little bit because the dirty little secret about the wait list with most practices is that they offer to put you on the wait list, but there isn't actually a wait list. It doesn't exist. The name might even go somewhere. No one's actively managing it, and it's typically quite manual. And the idea of how you're matching patients to say this new appointment that just became available is appropriate for them, it doesn't happen, and it falls apart quite quickly. So what's exciting about the Radix platform is there is actually an automated wait list that has all of the same rules that where you first match the patient to that appointment type, to that provider, with the patient preferences incorporated, things like I can only come in or do appointments in the AM or PM or only Tuesdays. All of that gets incorporated in there automatically. So then patients are only offered appointments that are actually appropriate waitlist appointments for them. And the idea of telehealth means actually, as opposed to having to say your waitlist gets cut off, 24 hours in advance, you can actually run it, to your point, up to the half-hour mark, up to an hour mark for those that are telehealth appropriate appointments, which is really exciting because it means even further reduction in terms of what you'd call a gap in the schedule because of a no-show or a last-minute cancellation. So today, for example, our wait list runs, at the end of every practice day. It runs for a few hours for appointments for the following day. And even that, you guys know, to make a physical appointment, it's difficult to make it happen within 24 hours. Yeah. But if it can be a virtual appointment, even without 24 hours notice, with an hour's notice, we'll have many more patients actually be able to make those appointments and be seen. So it increases utilization and the likelihood that the wait list is adding just that much more value to the practice and to the patient to be able to see the provider sooner in an easy manner for them.
So we made you cooler, right?
Exactly. If I can go to the doctor without going to the doctor, I'm happy. And to your point, it's hard to go carve out half a day for a 30-minute at best appointment, right? Yeah. And many times what you're seeing in your world with the growth of telehealth is you don't actually need to be in person. Right. And how do we make sure that we're getting patients to the right appointment? And so those that really do need in-person visits, there's also more supply of those as well. So it's really a win-win across the board.
Yeah, and I think it's, I'm talking to providers on a daily basis, on the telehealth side, we get the question, a lot of times is like, what's the ROI, right? And, on the telehealth side, it's typically 2 appointments per month per provider, and it's a positive ROI, down to just a couple of licenses from that perspective. And that doesn't take, all the, I wouldn't say total intangibles, but, increase in patient satisfaction and new patients and all those kind of things. When you look at online scheduling, what do you guys see typically as an ROI, or how do you look at it from that perspective on online scheduling?
Yeah, so we don't typically make a quantitative assumption around the value of that patient satisfaction, the patient experience. We know there's value there, but we're not thinking about that. It's a category. We don't put hard dollars against it. But what we do see is around increased utilization and reduced administrative overhead. So the idea that you can have a 2% increase in your appointment volume without any increase in the administrative overhead or any increase in the staff or providers that you need on hand to serve those patients, goes straight to the bottom line. And knowing the margins of what clients look like, it's really meaningful. So we think about utilization and that administrative overhead as the core components of the ROI outside of that patient experience.
Yeah. And I think as we, as this industry continues to grow, people are going to be, and I know there was a statistic out there, but people are going to continue to make decisions on providers on, being able to book appointments online and being able to book a telehealth appointment online. And what I tell practices all the time is, if somebody has a choice, if you offer telehealth and somebody has a choice to talk to their practice group or use a doc on demand or a WebMD or something like that and get a random doctor, they're going to go to you. But if you don't have it available, they're going to do whoever's available at 10 o'clock at night from that perspective. So I think, physicians have to think the way of, maintaining that face-to-face patient relationship of being able to do it both physical and virtual. Mm-hmm. And it's not a one-size-fits-all, right? It's not like do all virtual, do all physical. It's how do you, by patient, by appointment type, figure out like what's best from that standpoint.
So I want to close with and break down really how exactly it works, the nuts and bolts, so everyone's kind of clear on the opportunities for their practice of the way of the future of really bridging the physical and virtual worlds from an appointment standpoint. So online scheduling is on the practice's website. It shows the different appointment types, whether it's in office or whether it's telehealth, what's available. You can see providers, the profiles, maybe availability, locations, or telehealth. Put yourself on a wait list if there's no availability for the date and time that you're looking for. Book that appointment type. With that appointment type, you might get email or text reminders like you normally would from the patient standpoint with the instructions. If it's a physical appointment, it might have the address, some instructions there if you need to fill out paperwork, things like that. If it's telehealth, it's going to, be similar appointment type, but instead it's going to send you to that practice's website. It's maybe going to give you the code of the provider that you have the appointment with, or nurse or PA, and instructions from that standpoint, browser, webcam, things like that. The provider logs into the telehealth platform at their appointment time. They see the patient come into their queue, 2 clicks, they can accept it, have that telehealth appointment. They log, they chart in their existing EHR, no integration or limited integration needed there, or complete standalone depending upon the practice and what they want to do. And then the provider gets a quick survey, the patient gets a quick survey, provides their feedback from that standpoint. So pretty can be as kind of easy or as complex as you need depending upon integration to get started, both offering online scheduling as well as having virtual telehealth appointments. Did I miss anything, Emily, in that flow that stands out that needs to be covered from that standpoint?
No, I think that's right. I mean, our goal, to your point, is a ton of operational complexity behind the scenes, and we want to make sure we're serving that and doing that justice. But for the patient and the provider, it actually should be seamless and easy. When we think about online scheduling and booking an appointment, for a patient, it shouldn't actually be much harder than making a restaurant reservation or anything else out there. And getting that consumer experience side of it's really important. And the key is you can't ignore the operational complexity behind the scenes, but how do you hide it? And so things like, to your point, you get the notice, and if it's telehealth, it's easy. You've got 2 clicks and you're in. And if not, having options appear on, do you want to add it to your calendar? Do you want to book transportation now? And really thinking about it more holistically from the consumer side. But I think you broke it down really well.
All right, awesome. Well, to learn more about the joint solution of the partnership, click on the show notes. And if you have any questions for Emily or I today on the podcast, feel free to submit those questions. And as always, subscribe to get your weekly podcast right in your podcast player of choice. Emily, thanks so much for being on the show today.
Great. Thank you, Carrie. It was fun.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.